Good evening and welcome to our second live update for tonight. We are focusing this live update on information that we hope our parents will find useful. We spent the last from 6 to 6:50 focusing on information for our employees. So the chat is open for your questions and you'll be able to post questions there. We're going to go over some information first and then we'll get to your questions. And I started this off and didn't tell anybody who I was. I am Libby Roof, the Senior Chief Communications Officer for Richland 2, and I'm joined tonight by the fabulous duo, our Superintendent, Dr. Barron Davis, and our Deputy Superintendent, Dr. Marsha Lynn Franklin. Now, typically when I start these updates, when we were doing them last year, I would give Dr. Davis an opportunity to give us some welcoming comments. We're going to get right into it because we are limited on time. We restricted the employee update to just 50 minutes so that we would be on time starting this one. And so we're going to hold that standard to this update as well. We're going to stay with 50 minutes so that we're equitable and give the equal amount of time to both groups. And we're going to start with some updates, some overviews, and then we're going to get to your questions. Again, the questions are can be placed in the chat, and I have a team that is helping me keep up with those, and we'll get to as many of them as we can. And I will just make a personal plea that we use the chat as a way to post questions and in a way to also, while doing so in a respectful and collaborative manner. We want to use this time to help each other, and so the best way to do that is to respect and collaborate and work together. So thank you for being kind and welcoming and respectful in your comments on the chat. So let's start by talking about what district and school leaders have been doing this summer as we waited on guidance to come out from the South Carolina Department of Health and Environmental Control. We weren't just sitting around deciding not to do, we're not going to put any information out. We're like, why did you wait till almost August to put information out? And well, actually, we didn't get guidance until last Thursday from DHEC. And so there would be very difficult to put guidance out and then have to take some stuff back if DHEC had other information. So, Dr. Franklin, I'm going to ask to start with you if you can walk us through the process of what we've been doing this summer to get ready.
Very good. And so in mid-July, our district team began having conversations about what school may look like when we resume in August. Of course, we couldn't formalize anything because at that time we did not have guidance from the CDC nor DHEC, but we did start having the conversation. And shortly after that, the CDC did release its guidance for schools, and so we were able to come back together to add some additional touches to what we originally were planning to do. At that time, we were still waiting on guidance from DHEC, which would be specific to schools in South Carolina. And so we did, while we were waiting on DHEC's guidance, share our draft of what we were thinking the path that we would be taking with our principals, because they are our boots on the ground and worked in our schools last year with the health and safety protocols that we had in place then. So we shared our very rough draft of health and safety protocols with principals to receive their input. And so our principals gave us some additional recommendations. We factored that into consideration. We also published the ESSER survey, and one of the items on the ESSER survey spoke specifically to health and safety protocols. And with the ESSER survey, our parents participated in that survey, as well as our employees had an opportunity to participate. And so while the survey was going on, shortly thereafter, DHEC did release its state-specific guidelines and guidance for schools. And so we were fortunate at that time to be able to take the DHEC guidelines, the CDC guidelines, the feedback from and input from our principals, and feedback and input from parents and employees, and kind of pull all of that together to develop some final guidelines that we will be using in the coming school year. And I use the term final very loosely because, as you know, this is a very fluid situation and things change, not just day by day, but they, in some cases, change minute by minute. And so we do have a set of health and safety protocols, some of which we will share tonight. We've already shared those with our principals, and so if you have questions specific to your school, your principals will be able to answer those questions. But we will share much of our plan for health and safety tonight, either through the dialogue that we planned or the questions that you will ask.
And then on Tuesday night, August 10th, we will have a official reveal, if you will, of the plan, and our board meeting, it starts at 6:30, and we live stream those, so anyone can watch, and Dr. Franklin will be at the mic again, and we'll be giving that update. So, and again, a lot of that information we'll touch on tonight and then reiterate, and we'll certainly be posting it on our website. We have a back to school page, and on the just richland2.org/back to school. And on that page, you'll see a tab for COVID-19 information on the right-hand side. We'll be updating that information. And of course, you will get emails from Libby Roof with rehashing all this information multiple times. I think I even saw a comment on Facebook the other day where someone said they were looking forward to my calls and emails, and I was very appreciative of that. All right, let's go on to our next thing we want to cover before we get to the questions. And that is what has been guiding us this summer as we've been doing our work. And Dr. Davis, I'm going to ask you to touch on that.
Well, I will go and say, I guess in response to that, is what has always guided us. In our district, we've always prided ourselves on providing our students with premier educational experiences in a safe and secure learning environment. And we want to ensure that our environments are as safe and as secure as possible. And so in order for us to do that, we intend to follow CDC and DHEC guidance to the greatest extent possible, where we're not prohibited or restricted by law to do such. And in doing that, we will encourage and highly recommend that our students and employees who are capable of doing so wear their mask in schools. And we are encouraging those who are eligible to be vaccinated to also do the same. One of the benefits of being vaccinated is that if you are deemed a close contact, according to CDC and DHEC guidelines, you don't have to necessarily quarantine. And so that will allow us to keep some sense of normalcy in our schools and our classrooms. The law doesn't allow us to require or have a policy in place that will mandate that you do those things. And so we can't do that, even if we wanted to. As you all know from parents this last year, our position on masks and our position on following CDC and DHEC guidelines, we held fast and hard to those standards in our efforts to keep our community safe and keep our students safe. There are some limitations to what we can do this year. And so where there are limitations that are in place because of state law or law, we will follow those things. But where they're not, we intend to follow the DHEC and CDC's guidance that will allow us to provide premier educational experience in the safest and secure classroom environment and work environment as possible.
Thank you, Dr. Davis. All right, so what are we going to cover tonight? We have some topics, and they were what are called common or hot topics in the survey responses in that open-ended question that Dr. Franklin referred to regarding the ESSER funds. There were multiple responses that touched on similar items, so we want to hit those, and then we'll get to your questions. And the first one is just talking about, as Dr. Davis already touched on, what we can and can't do about the mask. And but we can now require masks on school buses, correct, Dr. Davis?
Yes, we received some. We received information earlier, or right toward the end of school, and starting the summer that masks were not. We couldn't require masks on the school bus, but we've now also received new information that says that because of the executive order, federal executive order, when it comes to transportation, masks will be required or is required to have on a mask while we're on the school bus. So our students and our employees who operate school buses and those students who choose to ride a school bus or need to ride a bus to get to school will be required to wear a mask while they're on the school bus. There are also some other places as well that masks will be required in schools. We didn't get a chance to touch on this a little bit in the first presentation, but in the health rooms and other areas that are deemed a part of the health care of those students. So a waiting area would be one of those areas where students will be required to wear a mask. So if a student goes to see the nurse in the health room or is placed in waiting on a parent to pick them up because they're sick. In those areas, we are allowed to require students to wear a mask, and we intend to do so.
And I want to touch on something, Dr. Franklin, I'm going to throw a question to you. I saw a comment in there about someone had been to an event last week, and they didn't see a lot of people, employees wearing masks. And I think it was last week or the week before, we were all operating under the recommendation that if you were vaccinated, the CDC said you really did not have to wear a mask indoors. That quickly changed. I think it may have been the week before, where CDC said because of the Delta variant, they did recommend if you're in public places indoors. And I mean, the next day we all came to work and we're walking in. We have it as soon as we get done with our thing tonight. As we walk out, we'll put these on. They're a little hard, make us hard to hear and understand, so we have them off and we're separated tonight. But that is one of the, I mean, really, up until about 2 weeks ago, we were operating on some very different guidance, and that's one of the things that's made getting this plan solidified and communicated out to you as soon as possible a little more challenging. But let's go back to, we've talked a lot about we can't require masks, and why exactly is that, Dr. Franklin?
So when our state legislature approved the state budget on June, I believe it was June 29th or 30th, there is a proviso attached to that budget. A proviso is pretty much like a law that prohibits schools and school districts from requiring employees and students to wear face coverings. And so that really kind of tied our hands as it relates to requiring masks of employees and students. And so when the governor signed the budget and approved the budget that was proposed by the state legislature, it also included that proviso that prohibits schools and school districts. So the very next day, our schools across the state had to stop requiring any employee or students to wear a mask.
That proviso is worded very cleverly, Dr. Davis.
Yeah.
You want to touch on what they tied that requirement to?
Well, it seems that the requirement is tied to the fact that you can't enforce a policy or a mandate, and it is attached to basically state funding. I think roughly about 60%, 63% of our funds as a school district comes from state funding. And so it begs the question of jeopardizing the possibility of having your funding withheld if you put such a mandate or a policy in place and then enforce it. And so we are looking at all the nuances of those things as a school district, because we do not want to disrupt or interrupt the education experience for our students this year. One thing is for certain, and that I think most of us can agree on, the importance of having our students in school. Not only simply having them in school, but keeping them in school. And so that's one of the reasons why we are where we can follow CDC and DHEC guidelines. We plan to do so because we want to do our very best in mitigating the spread of COVID-19 in our schools and in our classrooms. So where we have the ability to do so, we will. Where we don't, we will exercise as best we can our right to allow our students and our teachers, our employees, to have that choice if they deem it so at this time.
Let's
add
go.
one thing, I'm sorry.
Oh,
and just for clarity, because we've mentioned some instances where masks can be required,
Yes.
and we've said that there's a proviso that says we can't require masks. So just for clarity, there are two instances where an employee or a student can be required to wear a mask, and one is on buses because of the federal regulation, and then the other is if they are symptomatic and they're in a school building and they're either awaiting assessment by the nurse or they are awaiting to be picked up by someone to leave school for the day because they're symptomatic. So while they are in the health room, they can be required to wear a mask, as well as when they exit the building to leave for the day. So I just want to be clear about that we do have a couple instances where an employee or a student can be required to wear a mask.
And while we're on the mask subject, because this may be a question that comes up, I hadn't looked at the questions yet. I've got a team. While we're saying this, I got a team. I want to give a shout out to Ish Take, Carmen Brown, Don McAdams and I believe Will Anderson is on the chat helping to answer some questions as we go along, and then feed me questions that we will answer here. So they worked at the last session, they're working this one. Thank you guys, you make a great team. One of the questions that came up last time was City of Columbia mask mandate and how that impacts Richland too. Dr. Davis, you want to share information about that?
Yes, we verified by going to the city's GIS, which we were a little unsure if we had one elementary school that fell within the city limits, but we've come to find and have verified that we have no schools that are part of or in the city or annexed in the city. So all of our schools are currently located within the county jurisdiction. So that doesn't apply to us at this time.
All right. Let's move on to some other common topics from the responses. Dividers. Employees and parents both really talked about the dividers and would those be in place this year. And first I'm going to ask you, Dr. Davis, talk about the guidance from DHEC and CDC doesn't really talk about dividers this time, but you had a great observation about why you think that is and why we will still want to keep some dividers in place.
Yeah, I think the most important thing for us is that we understand that although CDC and DHEC doesn't identify dividers as the top mitigating factor or strategy to reduce the spread of COVID, what it does increase is levels of comfort for students and for parents as well as employees. And so since we can't require the mask, particularly at our elementary schools and in our middle schools up to at least to grade 6, we will be providing the dividers in our pre-K through 6th grade classes, with the emphasis being there because that is the population of students who are unable to be vaccinated, or the highest percentage of the population of our students who are unable to be vaccinated at this time. And so we will continue that practice, and we're working to ensure that those elementary schools and classrooms have the more stable plexiglass dividers versus the ones that we initially started out with at the beginning of the school year. And so we're looking to ensure that we have those in place in those classrooms.
Anything we need to add about the dividers, Dr.
For
Franklin?
grades, Dr. Davis specifically mentioned pre-K through 6 about the classrooms having dividers as they did when school ended the previous school year. And then in grades 7 through 12, we will have dividers available in the classroom to use as needed or as requested.
And it was an important point you made, Dr. Davis, in our meeting this week, is when you look at the layering strategies, as they call it, they have masks in there, and you know that they're working under the assumption that schools will be requiring masks. We can't in South Carolina,
Right.
And so that's an important reason to consider dividers.
It's one of the primary reasons why we place the dividers back in, because we have lost the ability to have the chief mitigating layer in place in our schools at this time.
All right, next topic that was commonly asked about or recommended that we continue doing is our cleaning. Dr. Franklin, why don't you kind of give us a quick overview of the type of cleaning that we'll see in our schools this year?
Okay, and so we're still focusing on cleaning touch points, like in areas where there's a lot of touching happening, like to push doors open or door handles. We're also focusing our cleaning using the electrostatic sprayers in specific areas daily, areas that are high traffic areas, like front offices, the cafeteria, the spaces where there are lots of people flowing through them or to them. And so those spaces will be sprayed daily at the end of each day. In addition to that, we're definitely prepared to spray individual classrooms where there is a student or an employee who has been identified as being positive.
Right, and along those lines, hand sanitizing stations, hand washing, will that have a strong presence in our schools this year?
Right, and so our classrooms will continue to have hand sanitizer available to students, as well as sanitizing spray of some sort, so that surfaces can be sprayed as needed.
And I'll take this moment to do a plug. I know Don McAdams is probably doing it on the chat, which is wash your hands, wash your hands, wash your hands. Remember the 22nd, sing a song. Happy birthday, I think, is the most commonly recommended song, but, so definitely we're gonna emphasize the importance of that. Visitors, coming into our schools, our schools are part of the community, and we want visitors, but we are gonna try to put some limitations on that for the purpose of safety, correct, Dr.
Right.
Davis?
Absolutely. Under the proviso that Dr. Franklin shared earlier, visitors are not included in that proviso, so we can require visitors to wear masks while on school grounds. And so we will be asking for we'll be bringing a recommendation to our school board, to our board policy, that we will require asking for face coverings to be required for visitors while they're visiting our schools and visiting our classrooms. We are also limiting visitors to the classroom. And right now we are looking to limit visitors to about two at a time to any classroom. So we do encourage or enjoy for our visitors, particularly our parents, to visit classes and see and observe their students. We would limit the time that they're there, how long they would be allowed to sit in that classroom, as well as the number at one time. Particularly at the elementary level, where we have our highest population of students who are unable to be vaccinated.
Right. And then one hot topic for parents about classroom visits is the first day of school, because we have a number of parents who are interested, especially since you didn't get to do it last year, in walking their students to the classroom. So just remember that there is a limit to 2 visitors in a classroom at a time. And so if you get to a classroom and you're dropping your student off, it may be a situation where you're kind of dropping off at the door or literally walking into the classroom and coming right back out, because there are other parents who are also waiting to bring their students in. So we thank you in advance for your understanding of that and for being patient in situations like that.
And contact tracing. So that's what are we doing when we are notified, we find out we have a student or employee in a class who has tested positive. What is the process for that? Either one of you can take that.
Right, so we're following the same procedure as last year. The parents received notification via an email to let them know that their student may have been exposed to someone or within close contact of someone who was symptomatic and may have COVID.
And we have, parents, if you're a close contact or you're in the vicinity, I think there's 2 communications. Your close contact is one type of communication. In the vicinity, meaning you're not a close contact, but you were maybe in the same classroom, and we'll continue to do that. We don't alert the whole school. There's reasons for that, but we do have a way for people to keep track of those numbers for their school, right. Dr. Davis.
We will continue with our COVID dashboard that we did last year. That dashboard will actually be activated today. So parents can go to our district's webpage and check out the COVID dashboard and see see the positive cases in a particular school as well as the district. One advantage, I think, when it comes to contact tracing and identifying close contacts was, I think, the amount of time, cumulative time you were with someone or around someone, plus whether or not you had a mask on. And so if that mitigating factor is removed, then you may be deemed a close contact, which would mean you would need to, if you're not vaccinated, you would then need to be quarantined for a period of time.
All right. This topic came up a good bit, and there's lots to talk about it now. We've definitely seen a rise and increase in people asking about our virtual and e-learning options as the numbers have really jumped up there this week, and we've gotten new information about the variant. Last year, early part of 2021, start 2021, we announced that we were not going to offer e-learning at all the schools. We were going to have our virtual program, and we're going to have a virtual program one more year for elementary. The middle and high will continue beyond this year. Dr. Franklin, can you walk us through how we kind of came to that decision about no e-learning in the schools?
Right, and so if you will recall, last year, we started the school year with everybody being virtual, and then once we went into phase 2 as well as phase 3, we had what we call dual modality, where teachers were teaching students who were in person and with them in the classroom and simultaneously teaching students online who were doing e-learning. And our teachers did a phenomenal job with that and endured to the end of the year, but we knew early on that that isn't a sustainable practice, and that's not something that we would be able to carry into the current school year. And so our virtual option for the current school year is the Richland 2 virtual program, but our traditional schools will just be providing in-person learning. We're required by law to provide 5 days of in-person instruction for our students.
Dr. Davis, Dr. Franklin touched on this. There's some laws that have limited our scope. We are required to offer 5 days instruction. There's another proviso or law that ties the number of students and funding. You want to touch on that for us?
Yeah, so there's a law that requires or will limit us to only having 5% of our population in our virtual format at one time. That 5% is based on your student body population, but that population or your ADM from the previous school year on the 135th day, which is the number of students that were in attendance or enrolled in your school on the 135th day of last year will be your 5% limit will be based off of that. If you exceed that 5% limit in your virtual format or virtual course offerings for your students, then you will not receive full funding for every student beyond that 5%. I think you actually receive about 47% of the funding that comes along with that student. So our funding would be, per student would be limited as a result of that. We also found, though, in addition to that, that many of us, I think, can agree on is that it's not sustainable for us to have the e-learning and the dual modality, and there is an increased importance on ensuring that our students are in face-to-face instruction and getting it at a high level, high quality instruction from a face-to-face method. And so we are, and that's why we are encouraging those students and those employees to be vaccinated, to wear a mask, so that we can sustain the number of days that our students are in school, because there are still going to be attendance requirements. The waivers that we were given last year and the flexibility that we had when it came to attendance, and all of those waivers have now been rescinded. And so we're back to pretty much operating when it comes to the laws and rules when it comes to schools and how schools should work, back to 2019, 2020 or 2018, 2019 school year. So we don't have the flexibilities that we had before. So it's going to be important that we have our students in school as best as we can.
The waivers is a good point, Dr. Davis, because the waiver on seat time, which the number of time we had to have dedicated to instruction school day, allowed us to have the days for planning. Mm-hmm. And when we say dual modality is not sustainable, it is not sustainable when you don't have that waiver and be able to give your teachers that extra planning time. Correct, Dr. Franklin?
Right, and the waiver for seat time, which would be like the required number of minutes a student is required to be in school. With that being lifted, we also cannot shorten the school day. And so you will recall last year, I think we had a 1 hour arrival and dismissal window for all of our schools, which made the school day shorter. And so with that waiver for seat time being lifted, we no longer have that flexibility as well. And so you will notice if you're receiving communication from your school that your school schedules in terms of their start time and end time are going back to what they were in August of 2019.
One of the things we don't have the flexibility to do either, it's tied to the 5-day in-person instruction, is we can't make the call that we're going to switch everybody to e-learning.
Right.
And we used that last year a couple of times, didn't we, Dr. Davis?
We did, as cases were rising or we were anticipating a rise of cases, or even coming back from vacations, spring break and other things like that, we were able to use a few days as e-learning days. Even for vaccination purposes for our staff, we were able to use a few e-learning days. We have lost the ability to have that type of flexibility to do those things.
And the guidance we've received from the State Department is that we really can't make a call to put a whole school on e-learning or the whole district on e-learning unless we get recommendations from public health that because of the numbers, that's what they say we need to do. So like if in any type of outbreak of the flu where they may step in and say, your numbers are high in your school and you need to do this, that's really the only way that we would be able to do that. And we can't make that call ourselves. Go back. We're on our questions now, and talk a little bit about the visiting. We have how will parents be able to visit with their children in the school? Dr. Franklin, we have a visitor policy in place. You want to explain how that what we did with that policy last year and what we're doing this year?
And so last year, because of COVID conditions, our on the recommendation of district administration, our school board suspended the visitors policy, which means we did not have visitors come into our buildings beyond the front office. June 30th of this year, that suspension ended. And so as of July 1st, we're back to allowing visitors in our buildings. And so our expectations for visitors are back to what they were in 2019, with the exception of our plan and a policy for Tuesday night is for visitors to wear face covering.
And to limit to...
Yes, and limiting the visitors in a classroom to 2 at a time.
And I guess we'll go ahead and approach the subject of meals.
Right.
We've come to the conclusion that it's best to not open up our meals time for parents to join their
Right.
students for lunch. And so that kind of leads me into asking you about what are the plans for lunches? That's when we usually have big groups of students together, lunches, breakfasts. You want to
Right,
talk
so
about that?
A part of our guidelines includes minimizing the number of students in the cafeteria at one time. And so, for example, if there are 4 kindergarten classes in a school, the principal or school administration will likely do an A-B schedule, where 2 of the classes will eat lunch in the cafeteria for a week, while the other 2 have lunch in their classrooms, and then the next week they flip-flop. And so the B classes would then have an opportunity to have lunch in the cafeteria for a week, while the A classes are having lunch in their classrooms. The lunch will be the same, so the meals are not different. They're designed or will be packaged in a grab-and-go style as they were the previous school year. So the meals are not different. What will be different is where students will consume the meals. And at the middle and high school levels, depending on the size of the school in terms of student population, as well as the size of the cafeteria and the spacing that they have, we'll get as many students in the cafeteria as we can with 3 feet of physical distancing. And then beyond that, our school level administrators are working on some different alternatives, which could include those students also eating in the cafeteria, eating in the classroom, or at satellite stations, designated satellite stations in the school or on the school grounds as well.
Dr. Davis, I'm going to circle back to mask. This question came up before and come up again. Will parents be able to request that if they're sending their child to school wearing a mask, that they are seated with only students that are wearing masks?
We cannot accommodate that request from parents. We would not be able to get into the monitoring, the enforcement of that should a child decide to sit somewhere else. We cannot enforce that and put that in place. We can't ostracize, isolate, identify anything of that nature. So unfortunately, the best we can do is ask those parents to encourage their sons and daughters, their children, to continuously wear their mask if that is their desire while at school.
And neither can we separate students based on vaccination
Yes.
status. And so we can't have, at the middle and high school level, an Algebra 1 class of vaccinated students and then an Algebra 1 class of non-vaccinated students.
I'm getting texts and new questions. My multitasking is failing a little bit here. Let me look at the next one. What guidance are we giving schools in terms of open houses, events, open house, or other, after school events, even we could throw athletics in there. What are we planning on doing for that this year?
Okay. Now, for events where a school will typically have a large number of people attend and be present for the event, if the event can happen and there be 3 feet of physical distance between the folks who attend, it can go on as planned. If we cannot accommodate everybody at one time, with 3 feet of physical distancing between the folks who are attending, we've suggested some alternatives to our building principals. For example, either switching to completely virtual for that particular event or doing a hybrid where you have some folks attend in person and others attend virtually, or to just stagger attendance. So for example, if we are doing an open house and we typically have hundreds of people, perhaps dividing it by last name and having them come in smaller groups in specific windows of time.
And there, before we got some updated guidance from CDC and DHEC, we just last week and week before, we may have had some events that looked a little different than they may look this coming week, because we've had to revamp, and like Dr. Franklin said, our plans are very fluid because really the changes have come at us quickly, and we've had to been able to respond. Let's talk a little bit about teacher vacancies, because we do have some parents who are asking about, do we have, they're hearing about the teacher shortage, they're hearing about the vacancies. How are our substitutes trained to fill in for those? What is kind of our practice with vacancies or when teachers have to be out? Let's start with vacancies. What have we been doing to really try to combat the teacher shortage in Richland 2?
Well, we've done a number of things to combat teacher shortage in Richland 2. I think the first thing that we want to do is, one, be appreciative that we have a fill rate that we have. So I know that's sometimes nerve-wracking. You hear the talk about vacancies and things of that nature, and we absolutely have teacher vacancies, but we have routinely had a fill rate of around 99%, 98, 99% in our school district. Because we have a lot of dedicated teacher and teacher professionals in our district. We have been aggressively and continually recruiting teachers. Everyone in our community, everyone in our district is a recruiter of teachers. And so we've been looking at hosting a number of teacher recruitment fairs, whether they've been virtual, whether they've been face-to-face. We did something phenomenal this past June, and when we had our budget approved, we increased our teacher pay to starting salary for our teacher is $41,000 in Richland School District 2, I believe. That's the highest in the Midlands and probably one of the highest in the state. We've done things like provide teacher and employee bonuses to our teachers over the last couple of years as well, to show our appreciation for the things that they do in providing educational experiences for our students. And so we've done a number of things. This year we are also providing our teachers, if they're participating in district, in some identified district professional development, that they will be receiving a stipend or compensation for their time outside of the classroom. We've done things like provide our middle school and our high school teachers with 2 planning periods. We are working to not encumber time for our elementary teachers when they're on their planning. We've done a number of things as it relates to trying to ensure that we have a high quality teaching staff employed in our school district. Our subs are trained to go into the classrooms and provide support when our teachers are not there. And our principals and our support staff, as well as our teacher and assistants, are also highly trained individuals that can help provide academic support while our teachers may be out or we may have a vacancy. We may have to make other decisions as it relates to classes if we have vacancies that are unfilled, but right now we're fairly confident that we'll be able to get the vast majority of our positions filled. And I just want to let parents know, in particular, that although the numbers are high around the state, we've done fairly well in our district when it comes to vacancy, particularly when you're talking to over 40 or 41 schools in our school district. So I feel confident that we'll have our classrooms filled to the highest, to our best ability, for sure.
Question about attendance, and if a student has to be quarantined, does that count against them in terms of attendance?
Right, and as of today, we haven't received any specific guidance about attendance. We do know that we're returning to our standard attendance structure where a student must be physically present in order to be noted as present in our student accounting system. But in terms of how we code for a student who's absent because of quarantine, we haven't received that guidance from the State Department just yet. But in order to be counted present, the student must physically be in the school, in the classroom.
If I'm not, I don't remember if that was a part of one of the waivers or not, the coding. So that's something we probably need to make sure that we shore up and have the information so we can provide that to you all as parents regarding if a student is quarantined, does that count against their attendance or the number of days because of that? Because they may not be positive, but we have to place them in quarantine as a result of CDC guidelines. So I would imagine there should be some flexibility on that, some leniency on that.
Yeah, I believe that has been the practice even with the flu, that there's a special coding for the flu, and I think even with these quarantines that they were basically put in that same type of coding. And then there's always the medical excuse from a doctor is considered a legally excused absence.
Yeah, I would think because we're actually telling them they can't come to school versus them not showing up.
Right.
So that would be
Exactly.
an attendance issue that we implemented, not them.
Let's go back a little, kind of backed up a little bit related to teacher vacancies. Have we been able to reduce class size to help with physical distancing? And that kind of goes with teachers as well as with the e-learning. E-learning helped us reduce the in-person. So I don't think the class sizes is something that we are able to use as a strategy right now because of the limit of our resources and our ability to
The smaller your class sizes, the more teachers you need.
and the more openings we would then have. Yeah.
The smaller class, I mean, it's an unavoidable formula. It's a part of the formula. The smaller class sizes you have, and the more students you have, then the more teachers you need in order to be able to meet those ratios. And I would say, we have some of the lowest ratios in the state as it relates to teacher-student ratios in our school district.
Let's see, I'm looking to see. In terms of the enrollment in the virtual school, we did that option in the spring. I believe right now we're at the point, it comes again down to staffing, but we have a waiting list. We aren't able to expand it because you have to fill the positions. Is that kind of the practice we have right now with the virtual school?
Right, and so based on the staffing that we have for the virtual school, particularly at the elementary level, the classes are full. Our virtual school coordinator is accepting names of parents, call and said they're interested in being considered for the virtual school, to be able to take your name and log the name and in the event that something should happen and a student who is already in the class does not attend or opts out of that and chooses to come back in person, then she will offer that slot to the next person on the list.
What about parents who want to maybe notify their school that they do want their child to wear a mask at school? I'm guessing they're thinking they're going to send their child to school with a mask on, and it's kind of like the missing coat that doesn't come back, but you send them to school with the coat on. And what type of position are we in to?
It still puts us in the position of enforcing the mask policy. So I think it's the expectation will fall, and the responsibility of that will definitely fall on the parent. Now, we can notify the parent and message the parent and let them know that he or she is not wearing the mask, so then the parent can address that issue when parent comes home about what the expectations would be for our family as it relates to wearing masks at school. But we won't be able to enforce that and require that student to get into, because once the student doesn't comply, then now we're in a position of enforcing that, which then possibly puts us in violation of the proviso.
Along those lines about what our teachers can and cannot do, can teachers ask students if they're vaccinated?
I don't think so.
No.
Yeah. No.
No.
That is considered, I think, private
Protected
medical
information.
information.
Right.
I do know that.
Not at this time.
Right,
Yeah.
very true.
And I'd say that with all sincerity, not at this time. They cannot ask that.
But the people who do ask that question are our school nurses.
Nurses and
Yes.
health room assistants.
I believe, Dr. Franklin, you may have seen the letters like I have, when a parent gets notified that their child has been in close contact and they have to quarantine, the information will be provided on how you can notify the nurse that your child has been vaccinated,
Right.
correct?
Right, so that's in the communication from the nurse directly to the parent.
And then our nurses have to verify that with DHEC, and then once that's verified, then that student would not have to be put in quarantine. So you can see how, we'll take this moment to see how much is on our school nurses. Mentioned earlier that there's not just COVID, there's other things going on in the
There are other
health room.
sicknesses that students have that demand the time of our school nurses, in addition to the possibility of an influx of students visiting the nurse's office as a result of complications or issues related to COVID.
Are we going to require testing for our students?
Yes. So what type of testing?
I'm sorry, COVID testing.
Oh,
COVID. That's a good point, Dr. Davis. I knew what I was thinking, but an educator is thinking.
We cannot require testing for students, as we can't require testing for adults at this time.
And in terms of daily screening and temperature checks, what's
so
in
we're
place for that?
We're still counting on parents to do that before students come to school.
We
do
will
the
not
check.
be.
So we will not.
We
yeah,
will not be
doing
screening the
that.
temperatures.
I think it was clear from guidance from CDC and DHEC that taking temperatures doesn't identify a student as having symptoms of COVID. It is in combination with other factors that could possibly identify them as someone who may have contracted COVID. So we did not do the temperature checks last year for every student that entered the building, and we don't plan to do those temperature checks this year. But we are asking that parents check the temperatures of their students prior to leaving home if they think that student is sick or possibly has a fever. And as in always, if they don't send them to school if you believe that they're sick, make sure that they're well before they come to school.
How will we, last year, one of the benefits of e-learning was putting, the student got in quarantine, they were able to still participate. I think our plans on this are still in the works, but what are some things that we might be looking at in terms of a child is quarantined? How are we going to help them recapture some of that lost instructional time?
And so the plans are still in the works, as Libby mentioned, but we do have a team of teachers from all three levels who have given input on what that might look like. And so we're working with our academics department, our academics team, to kind of flesh that out. But it will likely include some type of online assignment as well as online academic support while the student is in quarantine.
We are almost out of time because, as I mentioned, we stopped the employee one at 6:50, so we could get to this one on time, and I want to be fair and equal and give the same amount of time. We did get a lot more questions from the parents. We've touched on some. We've touched on a lot of them. I know we've had Don McAdams answering many. Will Anderson has been trying to. His technology has been giving him a fit. And I just want to make sure, these questions, even if we don't get answered tonight, are very helpful. As we mentioned, Dr. Franklin and maybe others will be at the board meeting next Tuesday night, going back over this information in more detail, and I think we'll be able to use some of these questions to help make sure we hit points that everyone has, or many people have the same types of questions. And again, I'm just trying to look through. We're down to like 2 minutes. Have we looked at legal counsel, Dr. Davis, as whether the budget proviso is constitutional?
Well, as you all know, we've actually approved to have our legal counsel added to our staff. As of right now, we are looking into whether or not it is. I think other entities are looking into whether or not it is constitutional. But until we get a definite on that, I think it's prudent upon us to not risk the funding of our school district. Some may agree and disagree with that, and I accept either position of that individual. Unfortunately, I have to make the decision that I don't think that's in the best interest of our school district until I know for certain what our position is.
Here's a quick one we can probably do in the last minute or so. Is PE classes, are PE classes being cut?
Are they being cut?
Yes.
No, ma'am.
No. We are looking at, I think last year they didn't dress out.
Oh, they didn't dress out for PE classes, right. And so we do have a plan in place for students to be able to dress out, but just minimizing the number of students who will be in a locker room at any given time.
All right, we are out of time. I'm sorry, I hope we touched on some of them and have provided you with some useful information tonight. Do y'all have any closing comments you want to share?
Dr. Franklin, anything?
I don't.
I would just say thank you again to our parents for being engaged and involved and helping us through your questions. We emphasize the importance of communications, and we believe that communication is us responding and sharing information with you. You being able to ask us questions in real time so that we are as informed as possible as a school district and as a school community. So thank you for your continued support. Please understand that this information is fluid. It could change a week from today. As we have seen day to day, there's new information that's being shared and new positions that are being shared. But please rest assured and know that our goal and objective is the same, which is to provide premier educational experiences for all of our students in the safest and secure environment as possible in Richland School District 2. And we're looking forward to starting this school year, and we're looking forward to receiving our students, and we're excited about the opportunity to provide them with all of the learning experiences that they so richly deserve.
Thank you, Dr. Davis, and thank you all for joining us. And remember to tune in next Tuesday night, August 10th. The board meeting public session starts at 6:30. We will live stream it, and we'll have a complete update on our plan. Of course, there will be information after that presentation posted on our website, and you can certainly expect to get some emails from Libby Roof with that information detailed in that as well. Thank you again so much for being part of the Richland 2 family, and we'll see you soon.